Welcome to the MCCSC Health Services Emergency Medication Training. Potential medical emergencies. Anaphylaxis, asthma, seizure disorders, and diabetes are common medical diagnoses that we see in the MCCSC. In order to provide the best care possible to students, it is important that all staff know how to recognize when a student may have one of these diagnoses, what symptoms warrant the need for an emergency medication, and how to respond during any of these potential medical emergencies. Each MCCSC school building has a health office that is staffed with health services personnel. As potential life-threatening conditions are reported, MCCSC health services personnel works with the student's parent or guardian and physician to put together a medical plan. These plans are then distributed to school staff and bus drivers so that all individuals know which students have a documented diagnosis. Staff are asked to store all medical plans in an easy-to-find location. In the classroom, it is preferable that these plans are stored in a red folder or binder. These plans should be accessible to anyone helping in the classroom, including substitute teachers. For bus drivers, we ask that you keep a copy of the student's medical plan in a readily accessible location on your bus. If you receive a copy of a student's medical plan, please review the plan and ensure that you reach out to the health office with any questions or needed clarification. Anaphylaxis and epinephrine autoinjectors. An epinephrine autoinjector administers a life-saving medication that is used for an individual experiencing anaphylaxis. Anaphylaxis is a severe allergic reaction that, if not treated in a timely manner, can become life-threatening. Anaphylaxis causes changes in the immune system that can lead to several complications, such as a sudden decrease in blood pressure and narrowing of the airway. As epinephrine autoinjectors are an emergency medication, some students may be permitted to self-carry their medication on them throughout the school day. If a student does self-carry their medication, it will be noted on their allergy plan. If they do not self-carry their medication, the epinephrine autoinjector will be stored in the school health office. For students that are prescribed an epinephrine autoinjector but do not have one at school, each school health office does keep a stock of epinephrine autoinjectors that are available if needed. Life-threatening allergy plans. When determining if an epinephrine autoinjector is needed, you should follow the student's personalized life-threatening allergy plan, also known as a FAIR form. For one or more severe symptoms, an epinephrine autoinjector is indicated for use. For two or more mild symptoms from multiple body systems, an epinephrine autoinjector is indicated for use. Severe symptoms include shortness of breath, wheezing, a repetitive cough, pale or bluish skin, faintness, a weak pulse or dizziness, a tight or hoarse throat, trouble breathing or swallowing, significant swelling of the tongue or lips, many hives over the body, widespread redness, repetitive vomiting or severe diarrhea, a feeling that something bad is about to happen, anxiety, confusion, or a combination of symptoms from different body systems. Mild symptoms include an itchy or runny nose, sneezing, an itchy mouth, a few hives or mild itch, mild nausea or discomfort. Administering an epinephrine autoinjector. When administering an epinephrine autoinjector, there are some key points to remember. Since this is a life-saving medication, anytime the medication is given, 911 must be called so that the student can receive additional care. Additional individuals that need to be notified include the building principal, health office staff, and the student's parent or guardian. An epinephrine autoinjector may be administered through clothing if need be. A good rule of thumb to remember is if removing the clothing is going to cause a delay in care, administer the epinephrine autoinjector through the student's clothing. In addition, you should note the time that the epinephrine autoinjector is administered and stay with the student until emergency services personnel arrives on the scene. We will discuss 3 different epinephrine autoinjectors: the EpiPen, Adrenaclick, and AviQ. All of these epinephrine autoinjectors provide the same life-saving medication. Administration of EpiPen. Form a fist around the device and pull off the blue cap. Firmly press the orange tip to the middle outer thigh. Hold in place for 10 seconds. After counting to 10, you can remove the device from the thigh and gently massage the area to help disperse the medication. The EpiPen does have a safety mechanism that will help to prevent any accidental needle sticks after it is administered. After the device has been removed from the thigh, the orange tip will cover the used needle. Administration of Adrenaclick. Remove the device from the case, form a fist around the device, and pull off both caps from the top and bottom of the device. Firmly press the orange or red tip into the middle outer thigh and hold in place for 10 seconds. After counting to 10, you can remove the device from the thigh and gently massage the area to help disperse the medication. The Adrenaclick does not have a safety mechanism. After the device has been removed from the thigh, the device should be placed back in the carrying case to prevent any accidental needle sticks. Place the case on a hard surface and insert the needle end into the case. Once the needle is completely covered, you can close the case. Administration of AviQ. Hold the device in one hand and pull down with the other hand to remove the case. Pull off the red safety guard. Firmly press the black end to the middle outer thigh and hold in place for 5 seconds. Once the case is removed, the AviQ will talk to you and walk you through administration step by step. Once the device says injection complete, you can remove the device from the thigh and gently massage the area to help disperse the medication. The AviQ does have a safety mechanism to help prevent accidental needle sticks after administration. For any of these epinephrine autoinjectors, if the paramedics that transport the student wish to take the used device with them, they may do so. If they do not take the used device, it should be transported to the health office for appropriate disposal. Asthma, respiratory distress, and inhalers. Asthma is a health condition that causes narrowing of the airway, making it extremely difficult for an individual to breathe. Students with a diagnosis of asthma may require the use of an inhaler. If not treated in a timely manner, asthma can become life-threatening. As rescue inhalers are emergency medications, some students may be permitted to self-carry their medication on them throughout the school day. If a student does self-carry their medication, it will be noted on their asthma plan. If they do not self-carry their medication, the inhaler will be stored in the health office. And for students that are prescribed an inhaler but do not have one at school, each school health office does keep a stock albuterol inhaler that is available if needed. Asthma plans. When determining if an emergency rescue inhaler is needed, you should follow the student's personalized asthma plan, also known as an asthma action plan. Symptoms of asthma and/or respiratory distress include shortness of breath, chest tightness or pain, wheezing, rapid or shallow breathing, and changes in skin color such as a bluish tint, which signifies a lack of oxygen. Administration of an inhaler with a spacer. Remove the cap from the inhaler and shake the device. If the inhaler is new or has not been used within 2 weeks, you will need to prime the inhaler by slowly pressing down on the top of the inhaler until you expel a spray of the medication. Insert the inhaler into the spacer. Have the student breathe all the way out. For a mouthpiece only, have the student form an O with their mouth and tightly wrap their lips around the mouthpiece. If using a mask, place the mask over the student's nose and mouth. Slowly press down on the top of the inhaler to expel the medication. If using a mouthpiece, have the student hold their breath for 10 seconds and then slowly breathe out. If using a mask, you can have the student hold their breath for 10 seconds and then slowly breathe out, or have the student take 3 to 5 slow, deep breaths with the mask still on their face. It is important that you wait 1 minute between each puff of medication. If there is little or no improvement to a student that is in respiratory distress or having an asthma attack after administration of an emergency inhaler, 911 should be notified. Additional individuals that need to be notified include the building principal, health office staff, and the student's parent or guardian. Seizures and emergency seizure medications. Seizures create electrical activity changes in the brain. There are many types of seizures, and symptoms can vary greatly. Some symptoms of seizures include staring spells, involuntary, repetitive, or sudden movements, shaking or jerking movements, confusion, loss of consciousness, breathing issues, and loss of bowel or bladder control. Some students may require the use of emergency seizure medications. When determining if an emergency seizure medication is needed, you should follow the student's personalized seizure plan, also known as a seizure action plan. Primarily, these medications are used for a seizure that lasts 5 minutes or longer, but some students may need the medication at other times. Therefore, you will want to time any seizure that a student has. Seizure plans. Indications for use of emergency seizure medications will be notated on the student's personalized seizure plan. If you have a student that is seizing and you think that you may need an emergency medication, it is imperative that you contact the health office. These emergency medications, because they are controlled substances, are stored in the health office, and you will want to have them readily available prior to the 5-minute mark when the medication is most often needed. For any student that is experiencing a seizure, it is important to remove any objects that may cause injury, such as desks or toys. For students that are seizing, remember to stay calm and time the seizure. Do not ever hold down a student that is seizing, and never place anything in their mouth. When administering an emergency seizure medication, there are some key points to remember. Since this is a life-saving medication, anytime the medication is given, 911 must be called so that the student can receive additional care. Additional individuals that need to be notified include the building principal, health office staff, and the student's parent or guardian. We will now review 2 common emergency seizure medications. Administration of rectal diastat. Place the student on their side. Gather the pre-filled syringe and lubricating jelly. Remove the cap from the syringe and lubricate the tip with the lubricating jelly. Remove the student's pants and bend the upper leg forward. Separate the buttocks to expose the rectum. Gently insert the tip of the syringe into the rectum and slowly count to 3 while gently pushing the plunger until it stops. Slowly remove the syringe from the rectum. Hold the buttocks closed for a count of 3. Keep the individual on their side and continue to observe. Administration of nasal Valtoco. Open the package and remove the device. Hold the device with your thumb on the bottom of the plunger and your index and middle fingers on the side of the nozzle. Insert the tip of the nozzle into one nostril until your fingers on either side of the nozzle are against the bottom of the individual's nose. Press the bottom of the plunger firmly with your thumb to administer the medication. Ensure the student is on their side and continue to observe. Type 1 diabetes and emergency medications for extremely low blood sugar. Type 1 diabetes is a health condition in which the body produces little or no insulin. Insulin is a hormone in the body that regulates the blood sugar or glucose levels. Type 1 diabetics rely on insulin via an injection or administration via a pump to regulate their blood glucose, since the body cannot regulate on its own. Both high and low blood glucose levels can be detrimental to an individual's health. Symptoms of low blood sugar. If an individual is experiencing low blood glucose levels in the body, they may exhibit symptoms such as shakiness, a fast heartbeat, sweating, dizziness, anxiousness, hunger, blurred vision, weakness or fatigue, a headache, or irritability. If the low blood sugar is not treated promptly, the student is at risk for severe hypoglycemia, in which they may begin to have a seizure or they may become unconscious. If a diabetic begins seizing or becomes unconscious due to hypoglycemia, they need emergent medical attention. There are two common emergency medications that we see in the MCCSC for severe hypoglycemia. Students are encouraged to carry these medications with them throughout the entire school day. Administration of glucagon. Place the student on their side. In the medication case, you will find a glass vial and a pre-filled syringe. Remove the cap from the glass vial. Pull the cap off of the syringe to expose the needle. Insert the needle into the vial and inject all of the liquid from the syringe. Shake the vial until the contents are completely dissolved. Withdraw the appropriate amount of solution from the vial into the syringe by slowly pulling back on the plunger. The dose of medication needed will be listed on the student's individual healthcare plan. Once you have drawn up the solution, remove the needle from the vial. Check for air bubbles in the syringe. If air bubbles are present, tap the syringe to get the air bubbles to the top and then gently press on the plunger until the air is removed. Insert the needle at a 90-degree angle into a large muscle, the upper arm, thigh, or the upper outer area of the buttock. Withdraw the needle and apply slight pressure to the injection site. Keep the student on their side and stay with the student until the paramedics arrive. The student should not have any food or drink until they are fully alert and can safely swallow. The used syringe will need to be discarded into the red sharps container found in the health office. Administration of nasal Baqsimi. Remove the shrink wrap from the yellow case. Open the lid of the case and remove the medication device. Hold the device between your fingers and thumb. Do not push the plunger yet. Insert the tip of the device gently into one nostril until your fingers touch the outside of the nose. Firmly press up on the plunger until it stops and the green line disappears. Keep the student on their side and stay with the student until the paramedics arrive. The student should not have any food or drink until they are fully alert and can safely swallow. Since these are life-saving medications, anytime glucagon or Baqsimi is administered, 911 must be called so that the student can receive additional care. Additional individuals that need to be notified include the building principal, health office staff, and the student's parent or guardian. Opioid overdose and Narcan. Narcan or naloxone is an emergency medication that is used to treat opioid overdose. Opioids are a class of drugs, and medications in this drug class are often used to treat pain. If an individual takes too much of an opioid medication, it can lead to an overdose, and if not treated promptly, can lead to death. Signs of opioid overdose may include weakness or body limpness, pale, blue, or purple lips and or fingernails, indicating a lack of oxygen, cold and clammy skin, a slowed or stopped heartbeat, or slowed or stopped breathing, pinpoint pupils, and unresponsiveness. The MCCSC stocks emergency Narcan in all buildings. This life-saving medication can be found in all health offices and AED boxes across the district. Administration of nasal Narcan. Open the package and remove the device from the box. Hold the device with your thumb on the bottom of the plunger and your index and middle fingers on the sides of the nozzle. Insert the tip of the nozzle into one nostril until your fingers on either side of the nozzle are against the bottom of the individual's nose. Press the bottom of the plunger firmly with your thumb to administer the medication. Ensure the individual is on their side and stay with the individual until emergency medical services personnel arrives on the scene. With any of these medications that we have discussed today, it is important to remember that we provide training to help increase awareness and help individuals feel empowered when dealing with a medical crisis. The quicker that you notify the building level health office staff and call 911, the quicker that support will arrive. Health services personnel will always take over student care when they arrive on the scene. If you are a staff member with the MCCSC Transportation Department and a student riding your bus has a medical emergency but does not self-carry their emergency medication, please pull over and call 911 immediately. If you have questions about this training, please contact the health office or the Director of Health Services. Thank you.